All right. Good morning, everybody. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take just a moment to click buttons to make sure that all of you have permission to record. You will have permission to record this briefing, and we are also recording, and that link to the video will be made available on the Snohomish Health District's website later today. So give me just one moment. All right. I think I've given everybody permission, but if for some reason it didn't go through, go ahead and send a chat to the Joint Information Center and I can get that fixed. We are joined this morning by Snohomish Health District Health Officer, Dr. Chris Spitters, Snohomish County Department of Emergency Management Director, Jason Biermann, and Public Information Officer for the Marysville Fire District, Christie Veley. Each of our speakers will be sharing an update, and after they've all spoken, they'll take questions using the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see. And with that, I will turn it over to Dr. Spitters.
All right, well, thank you, Heather, and good morning, everyone. We're grateful to have some cooler temperatures today, but it still looks to be a very warm week ahead. I want to thank all the organizations and partners that have stood up cooling centers over the last few days. They've certainly saved a lot of suffering, hospitalization, and potentially lives in this dangerous heat. I also want to thank people that were looking out for their neighbors, friends, and family, like those who left extra water or drinks for delivery drivers, people taking extra care of our furry friends, and vulnerable residents. Snohomish County has demonstrated yet again what a resilient and community-focused county we are. Jason and Christie will have a few other topics on the heat front, so I'll move on to COVID updates. Unfortunately, our 2-week case rate now shows flattening. We're going sideways. For the period ending June 26 through last Saturday, the case rate remained at 69 per 100,000 residents. Now that, if you do the math, that's roughly 300 cases per week. But if you look at it in 1-week blocks instead of 2-week blocks, we actually went from 305 cases down to 287 and then back up to 304 cases last week. So we're actually going back up a little bit if you look at it week by week. This is certainly concerning given that we don't have complete vaccination of the community and we've got these more contagious variants going around. So and not least to mention that, you know, forthcoming liberations on June 30. So it's really incumbent on all of us to keep our heads on, be safe and careful, especially unvaccinated folks in public indoor spaces need to continue wearing masks and trying to stay spread out from others. And more importantly, go get vaccinated. So we'll be monitoring these metrics closely in the days and weeks ahead, but this is just yet another signal that while we may feel done with COVID, COVID isn't done with us, and we are just, you know, we honestly don't know what the future holds. We know that things are looking good and vaccines rolling out and cases have come down considerably off the peak of the 4th wave, but this is not over yet. So don't forget that. Be smart, get vaccinated. If you're not vaccinated, mask up. All right, so let me move on here. Tomorrow is an exciting milestone as Washington is set to reopen. We have come a long way and sacrificed a great deal to get to this point, including my 2 colleagues who themselves and their organizations have made great contributions to getting the county this far. So while most of the restrictions and guidance is expiring or at least softening tomorrow, it's really up to all of us to do our part so that we don't undo all this hard work we've done. You know, it's very hard to put things in order, and once you let them get out of order, it's even harder to get them back in the box, so to speak. So please be smart. think of tomorrow as an ending of one chapter with a promising note about what's to come, but there's still a lot of the story left ahead before we get to the end of this COVID thing. And honestly, we don't really know how long that will be. So the only way to shorten that and lessen the effect is to be smart, mask up if you're not vaccinated, and again, above all, get vaccinated. So let's work together to make sure we all get a happy ending to this story. Speaking of happy things, I want to end with some exciting news that we received late last week. The Health District is one of 73 awardees nationwide to receive a substantial grant from the U.S. Department of Health and Human Services Office of Minority Health. The grant title is called Advancing Health Literacy to Enhance Equitable Community Responses to COVID-19. It's part of a new 2-year initiative to identify and implement the best practices for improving health literacy in order to enhance COVID-19 vaccination and other public health mitigation practices among underserved populations who have been hit so hard during this pandemic. Health literacy is a person's ability to find, understand, and use information and services to help them make health-related decisions for themselves and others. So this will benefit not only the COVID-19 response, but I think it will create a sort of an infrastructure that can translate into other aspects of community health as well. This $4 million grant kicks off July 1 of this year, and we are thrilled to be working with Edmonds College, Bastyr University, Snow Isles Libraries, and Snohomish County on this effort. I want to congratulate all the staff that put the work in to apply for this grant, and thanks to the partners who will be working with us on implementing it. So with that, I'll turn it over to Jason Biermann, our county's Director of Emergency Management. Jason.
Thanks, Dr. Spitters, and good morning, everyone. I just want to reiterate a couple of things before I go into the update around the mass vaccination work. Dr. Spitters mentioned the resilience of our community, and I think it's incredible to reflect on the last 18 months and having gone from severe snowstorms through the pandemic and then to record-breaking heat over the last couple of days. I think it's an amazing testament to the resilience of our community and the partnerships we have with folks who are represented. And Dr. Spitters, you're always really kind about pointing out emergency management, and the Snohomish Health District has been a remarkable partner, as has our fire and EMS community, our law enforcement, and healthcare throughout the community. It's just a true testament to Snohomish County. Some updates on the mass vaccination work and the work of the vaccine task force. We are now wrapping up what has been a 6-month-long mass vaccination effort, during which the task force administered just shy of 320,000 doses of vaccine. So to put that in context, if all of those doses had gone to Snohomish County residents, and we know that they didn't because there are folks who came from outside of the county to our sites, just like there were Snohomish County residents that got vaccinated in other counties. But to put that in context, if those had been given just to Snohomish County residents, that would represent 37% of all the doses administered in the county. So I don't have an exact percentage because we do know folks migrated to other counties and folks migrated from other counties in, but it's a substantial contribution to the overall effort, and made possible through the partnerships we have with the agencies throughout the county. So going forward, 2 of the remaining mass vaccination sites are going to be demobilized this week. The Arlington Airport and the Evergreen State Fairgrounds location in Monroe will both be demobilized, and that will bring us down from the 7 sites we had at the peak of our operation down to just 1 remaining site, which is the Ashway Park and Ride in Linwood. That location is going to be providing second doses of Pfizer vaccine during July, and that's so we can make sure that everyone who got their first dose can come back and become fully vaccinated through that location. We expect that site will convert to second dose only after July 10th, so there will still be some opportunities to get a first dose there, but toward the end of July, we expect that site will begin to wind down as well. We've seen over the last month, interest and demand at our sites has diminished. I think everyone's aware of that. But as the demand at the MassVac sites has gone down, The interest in community-based clinics has increased, and we've responded to that. The vaccine task force has now provided more than 30 community-based clinics just in the month of June alone. Excuse me. Sorry about that. That includes both first and second dose clinics, and with the Pfizer vaccine available to people ages 12 and older. So some of these clinics are small and only draw a few dozen folks. Some have been drawing several hundred. The important thing for us, and something we've reiterated since the start of this, is that we make vaccine as accessible as we can to as many people within the county that we can. Some of these clinics have been promoted publicly. Others have been held at schools in partnership with churches or other community organizations. So again, our goal is to reach as many folks, including and importantly, our historically marginalized communities as possible. So like Dr. Spitters mentioned, as we transition and we close the mass vac sites, we are continuing to run these community-based clinics. It is important for folks to continue to get vaccinated. We know vaccine supply is now meeting demand. Demand is slowing. There are other providers, as there have been all along. Please go and get vaccinated if you haven't been already. If you've been vaccinated once and the requirement is a 2-dose regimen, please get your second dose. Vaccine is available throughout Snohomish County. Make an appointment, go. Some places have walk-in capability. I want to say thanks to the 400,000 or so residents who are now fully vaccinated. We have made great progress, as Dr. Spitters mentioned. But keep in mind that for some folks going back to pre-pandemic life, and Dr. Spitters mentioned the reopening, that's going to be more difficult for some than others. Some folks are not going to be ready to go out and gather. Some folks are going to want to continue to wear a face cover. Please be respectful of those people and continue to acknowledge that even if you're ready to get back to your pre-pandemic activities, it's still important that you do that cautiously. It's still important to recognize that there are some folks who aren't ready to do that. So continue to stay home if you don't feel well. Continue to mask up if you are unvaccinated. And again, please do get vaccinated. Or if you're in a setting where other folks might be unvaccinated, and be mindful of the distance that you keep from others. We've made a lot of progress. It seems like a very long 18 months, but we've made a lot of progress. As Dr. Spitters mentioned, COVID is not gone. And there are lots of other things challenging us, including extremely hot weather. So having hopefully gotten through the worst of this most recent hot weather, we do need to address what's forthcoming. And with that, I'm going to turn it over to Christie Veley. Christie represents Marysville Fire District. They're one of the amazing partners we've had in our fire and EMS community throughout the COVID response. And she's going to be talking about safety during the upcoming 4th of July holiday and just the hot weather in general. So Christie, I'll turn it over to you.
Thank you, Director Biermann. Hi, everyone. So we know that the heat is bringing a lot of risk to our community. We're definitely seeing it here at Marysville Fire District. We normally receive about 40 calls for service every day. And just yesterday, we more than doubled that. And I imagine that's what's happening at fire agencies across the county. So I want to talk about a few of the bigger risks in our communities right now and some ways that we can all stay a little safer. So one thing we are really paying attention to right now is our fire risk. We are very, very dry. And that means that any fire is going to spread a lot more quickly. The danger is particularly high along I-5 and other highways where you have a lot of brush and trees that are very dry. We really cannot emphasize enough, please do not throw cigarette butts from your car window. Douse your cigarettes in water or sand or a safe ashtray before throwing them away. One little spark is all it takes to start a big fire right now. I-5 and other roads are particularly a challenging place for firefighters to fight fires because there are no hydrants nearby. And the heat also impacts how long it takes for firefighters to tire out and need a break. So that impacts resources. Besides properly disposing of cigarettes, we ask you not to park on dry grass and to make sure no chains are hanging from your vehicle or trailer to avoid any possible spark there. You also want to avoid mowing your grass during the hottest days or during the hottest parts of the day. And we really, really urge everyone not to use weed burners. We have seen a lot of fires over the years caused by weed burners. Snohomish County is under an outdoor burn ban, and that means no outdoor burning except for grills and small campfires. We really advise you not to burn at all if you can avoid it. We're particularly concerned about the fire danger this week and through the July 4th holiday, with so many people planning on celebrating with fireworks. That is just going to be very risky this year because of our dry weather. So if you live in an area where fireworks are illegal, please respect that. The laws are in place because the risk is so high. If you are in an area where fireworks are legal, please use extra caution. Make sure those fireworks are out and doused with water before you throw them away. Make sure you're staying clear of any structures that could burn. And if you can skip the fireworks and just go see a professional show instead, we really encourage that. There are a lot of shows happening this year, a lot more so than last summer. If you do have a fireworks complaint and there's not an immediate threat to someone's life or someone's property, then we encourage you to use the non-emergency number for Snohomish County 911, and that is 425-407-3999. And that's just going to help keep those emergency lines open for people who really need immediate assistance. So another message we really want to get out today is not to let your guard down when it comes to the heat in your body. Fire agencies all over the county are responding to heat-related illness calls. As of yesterday afternoon, firefighters have responded to several dozen calls for heat strokes and dehydration across the county. And that was before the really, really hot weather hit yesterday evening. And as you might expect, those calls really started picking up even more in those evening hours. So today is going to be milder compared to the last few days, but it will still be hot. So we really urge everyone to stay hydrated, pay attention to your body. If you're feeling weak, you need to get somewhere cool immediately. Drink some water. If you're feeling dizzy or nauseous in the heat, you need to call 911 and get help right away. It's really important right now that we're checking on our neighbors, our elderly family and friends, children and pets, because those are going to be the groups at highest risk in the heat. Stay inside during the hottest parts of the day if you can. So one thing many of us in the Puget Sound area do when it is hot is we open our windows. But if you have children in your house or children visiting your home, you want to make sure you have window stops or guards to keep those windows from opening any more than about 4 inches. Over 4 inches is all it takes for a small child to fall from a window. We unfortunately respond to window falls involving children every year in the spring and summer months. This year in April, we responded to a very serious window fall. A 2-year-old boy fell from a first-story window onto concrete below. The child was flown to Harborview Medical Center with critical injuries. The fall was about 6 feet, and that tells us that even a fall from a first story can be very serious if you're landing on a hard surface. Window screens, a lot of people think that's enough to keep a child safe, but window screens are built to keep bugs out, not children in. So having those window stops and guards is really important. Those devices are actually going to stop your window from opening all the way. And there are a lot of different types of stops and guards to fit all kinds of different windows and all kinds of different budgets. And if you need window stops, then check with your fire department because it's possible they might have some available for free. Besides opening windows, we also know that a lot of people are trying to cool down in the water right now. The message we have for you is wear your life jacket. It doesn't matter if you're a strong swimmer or an athlete or a bodybuilder. Cold water, and our waters are still very cold right now. Cold water can send your body into shock. And if you're not wearing a life jacket, you're at very high risk of drowning when you go into shock because you're not going to be able to swim. We want everyone to cool down, but do it safely. Wear your life jacket. And if you're visiting any public parks in the county for swimming, there very likely may be a free life jacket loaner cabinet, and there are life jackets there that you can use for the day for free. When it comes to having children around the water, we just urge strong supervision and life jackets. So thank you all for helping us get these messages out and helping keep our communities safer because we really are in this together. Thank you.
Thank you, everybody. We will now take questions through the chat box. Please enter your questions and we'll get those going. First one from Keith is, with the state fully reopening tomorrow, are you concerned the flattening of cases and turning back up is going to get worse? Dr. Spitters?
Yes. Clearly, right now the short-term trend is up. We've got good, but not impeccable vaccine coverage. And, we're going to have less mask wearing, even potentially by unvaccinated people indoors. That's why I'm really urging folks to, follow the rules. The masks don't come off for unvaccinated folks when when the gates open, so to speak, tomorrow. We got to stick with that, got to stay spread out and really try to get vaccinated. But meanwhile, more gatherings, especially without masks, especially indoors, bad idea, especially in the context of these variants, particularly the Delta and Gamma, which are more contagious, and we might have more breakthrough cases associated with them. So let's try to, things are easy to put back together and reverse when they're small. So notwithstanding the forthcoming liberation, I really urge people to keep the masks on if they're not vaccinated and go get vaccinated.
Next question from Ryan. What are you finding at this point in the pandemic through contact tracking or tracing? And how is it being used with vaccines widely available and a lot of residents having had at least one shot?
Well, fully vaccinated individuals, that is those who are 14 or more days following their second dose of an mRNA vaccine, that's Pfizer or Moderna, or if they're 14 days following the Johnson & Johnson vaccine, they're considered fully vaccinated. And if they get exposed, if they're identified as a contact of a case that we're investigating, we do not require quarantine of those individuals. Now, that doesn't imply the vaccine's perfect. There will be occasional breakthrough cases as a result of that. But you got to remember the vaccine is very effective, so that we've had statewide about 4 million people get fully vaccinated, and we've only had 2,000 breakthrough cases. So that's like 1 in 2,000 vaccinated people, whereas we're looking more at like 1% of unvaccinated people getting infected. So it's a huge difference in protection. Now, so unvaccinated folks who are contacts, they got to quarantine and stay home and stay away from other people for 10 days. And then we encourage them to go get vaccinated when their quarantine is through.
What is your biggest concern as the state reopens? Dr. Spitters and Jason?
Yeah, Jason, why don't you take a crack and I'll come in around you.
You're probably better suited. The biggest concern, I think, for us is just, I think it's just being able to help manage if there is another variant, if there is something else, and just understanding that with COVID not being gone, it does create complexity with other things like, for example, even the cooling shelters, the cooling work that was done over the last weekend. The governor stepped in and made some modifications that allowed folks to get in closer proximity. But again, COVID sort of complicates everything we do in disaster response at this point, from firefighters who, in their PPE, through folks' ability to congregate. So the biggest concern, I think, for us is just folks being mindful that COVID is still real and out there. And it does create a lot of complexity in all facets of the work we're doing.
I agree completely, Jason. And I think it speaks to the, just the reminder that we're not through with this. And, cases are coming down due to the vaccine, also probably somewhat due to COVID may not be as seasonal, say, as influenza, but there's probably an aspect to that as people move outside less gatherings indoors, less transmission cases come down. So another way of viewing the current good state is that we've got a window of opportunity to do a little better job getting the rest of the community vaccinated before we head into the fall and winter months, when I think there is likely to be some level of resurgence. And the more we get vaccinated now, the less we're likely to see that. And then the smarter people can be who are unvaccinated about masking up when they're in groups in public, the less transmission we'll have now, creating competition for other vital resources like the time and energy of my two colleagues here. So please, don't underestimate COVID. And I think, summing it up, complacency and non-compliance with public health recommendations are probably our biggest threats, along with the uncertainty of what the variants and their descendants hold for us in the future.
How do you keep pushing folks to get vaccinated as the lotto winds down and the state reopens?
We're trying to do it right now. Go get vaccinated. If you're not vaccinated, please go get vaccinated. If you have doubts about it, if you're concerned about the safety or the science behind the vaccine, consult reputable resources like CDC's Advisory Committee on Immunization Practices. You can just Google CDC ACIP COVID vaccine. Take a look at the materials there. Talk to your healthcare provider. Talk to people who have been vaccinated. The benefit to risk ratio of this vaccine is phenomenal, and it's our way out of this in the long run. And so we just have to keep announcing that to folks. I don't know what else to do.
And just to add one thing, all of that obviously being spot on, if you are vaccinated, proactively reach out to folks that are not. Just like Dr. Spitters was mentioning, if you're not, ask folks who are. But if you are, also proactively reach out to folks who are not and encourage them. We're not out of the woods yet. So if you've been vaccinated, that's fantastic. Encourage everyone who is not to get vaccinated.
And can you speak to the accomplishment from your ends on getting to a point with vaccinations where we can safely reopen, maybe for all three of you?
Well, I'll start out, and it is a great accomplishment. The work of, from the scientists to the vaccine manufacturers, the people that distributed it all around the country, the state health department coordinating it, and then Department of Emergency Management, EMS, the health district staff, the healthcare system working on getting it into people's arms. We haven't seen anything like this in my lifetime, and it's just a great accomplishment. But we're not, in the end zone yet, so to speak. We're getting close, but so we've got to, we can take some relief and pride in where we've arrived as a community, but we're not out of the woods yet. So you got to stay focused, stay disciplined with those prevention measures, and again, encourage your unvaccinated friends, family, coworkers to consider it. And if they have concerns, it's from this point on, I think, broad messaging, mass vaccination clinics, we've kind of done what we can do with those things, and we've gotten the easier to vaccinate folks taken care of with that. Jason mentioned the community-oriented clinics. That's one way of reaching harder to reach populations, and one-on-one conversations between friends, family, patients, and healthcare providers to address those concerns that aren't so easily addressed through mass information efforts. So have those conversations, and let's get further toward the end zone here.
Jason or Christie, anything to add?
Yeah, I think Dr. Spitters covered it really well. I mean, a saying of mine that folks hear me share often over here in our offices, disaster management is the ultimate team sport. That's kind of a motto we use. And to your point of the accomplishment, I think it's an amazing testament to the team. And the team, as Dr. Spitters mentioned, starts with folks who develop vaccine all the way through folks who took time off in their busy schedules to go and make an appointment and get vaccinated. So yeah, I think it is great that we were able to provide this service with the support of folks like our fire and EMS colleagues and the health district and the healthcare providers and all of these things. But we don't want to lose sight of the fact that COVID is not completely gone. I do think it's, the accomplishment, I think, is the fact that the teamwork and the partnership really did get us to a point where we could at least be talking about safely reopening, but again, ask everyone to continue to do their part to make sure we don't, increase any risk of going backward.
I'll just add that I really think that we should all feel very fortunate to live in a county where so many agencies can come together to do something like this in a public health emergency. I know I can speak from, the perspective of a fire agency, but you had fire agencies coming together with healthcare partners, coming together, with the Department of Emergency Management and the health district. I mean, transportation, there's so many people who played a role in this effort. I know we were glad to be a part of it. And I just feel fortunate that we live in a county where people can come together like that for the greater good.
Great. Well, thank you all three. And that gets us to the end of our call. We're going to go ahead and wrap up for this morning. Thank you again for joining and for all your questions. Please stay tuned for future media availabilities and try to stay cool out there.